Mr. Chair and members. AB2260, which would require certain public and private buildings constructed after January 1st, 2022 to install and maintain 6 trauma kits on their premises in order to treat people in need of emergency medical care during a traumatic emergency event. In response to the tragic mass shooting at Sandy Hook Elementary School, a group of doctors convened a panel of national experts from law enforcement and emergency medical services to create an improved response system directed primarily at the control of life-threatening blood loss. In their recommendations, the group of experts concluded that bystanders, immediate responders should be trained and empowered to stop hemorrhage in order to save lives. These experts also recommended trauma kits be placed in public places such as shopping malls, schools, sports venues, transportation centers, etc., next to AEDs. Recognizing the difficult to maintain direct pressure, they also recommended the use of tourniquets to control severe bleeding. With mass casualty events becoming more common, in 2015, President Obama launched Stop the Bleed campaign to encourage bystanders to become trained and empowered to take life-saving action while EMS personnel are en route. Sacramento, like communities across the country, is no stranger to these traumatic emergency events. In the last 5 weeks, there have been 2 mass shootings that have taken the lives of 10 innocent victims. During these tragic events, a person suffering from severe blood loss can die within 5 minutes, so every second counts. That's why it is so important to ensure our immediate responders have the instruction and equipment needed to save and render emergency care at the scene of emergency. With me to provide testimony in person are Amy Liepert, a trauma surgeon and associate professor at UC San Diego School of Medicine, and Tyler McCullogh, who is an RN with the California Emergency Nurses Association.
Thank you. Your witnesses are here.
Amy's on the way, but you can start.
Okay, that's fine.
Thank you, Mr. Chairman and committee members. My name is Tyler McCullogh. I'm a registered nurse working in the emergency department. We pride ourselves on taking care of trauma patients, but we can only take care of them if we get them. This trauma kits would help we receive more patients in the emergency department. As Assemblymember Rodriguez stated, people can die in 5 minutes, oftentimes less. We can't do anything if we can't help the patient if they can't get to us. So this bill would just save more lives and help hemorrhagic loss in the field.
Thank you.
Good afternoon. I thank the committee for the privilege of addressing you. My name is Dr. Amy Liepert. I am a trauma surgeon, associate professor of surgery at the University of California, San Diego. I'm a double board certified general surgeon and in surgical critical care. I'm here today representing the American College of Surgeons, the 3 chapters in California, the American College of Surgeons, and myself. I work at an American College of Surgeons Level 1 verified trauma center and provide the most advanced and expedited care to injured patients. Just as the Level 1 Trauma Center here at UC Davis provided this level of care to this very community just a few short days ago, and as they do every day. The caveat to this care is that the injured and bleeding patient must survive long enough to arrive at the trauma center before they have died from bleeding out. With a major bleeding injury, an adult can bleed to death within 5 minutes, even before emergency medical services can arrive. Injuries to the arms, legs, and scalp can be treated with minimal equipment that is both easy to use and easy to train the general public. This is a trauma kit that can allow patients to survive transport to the trauma center. It contains simple equipment like gloves and a mask, trauma shears or a scissors that's blunt tipped to remove clothing to access the wound, gauze packing that does not expire, and a verified tourniquet that can be taught to the public easily and simply to save lives. The Stop the Bleed program is sponsored by the American College of Surgeons, the White House, the Department of Defense, and the Department of Homeland Security. It is currently taught by U.S. trauma surgeons in the Ukraine to maximize the survival of injury there. And while many of these techniques were developed and initially studied in the combat environment, they are generalizable to all sources of bleeding that occur in civilian life. I have treated patients that have had needed tourniquets or other bleeding control techniques applied after motor vehicle or motorcycle crashes, industrial accidents, home shop incidences, and even breakage of glass windows or coffee tables. Natural disasters such as earthquakes is another potential source of major vascular and bleeding injury. Education to the public is widespread and free. California has led the effort to require ready availability of AEDs, co-locating these bleeding control kits within those same containers and locations make these tools accessible to save lives and reduces cost. AED manufacturers even encourage this co-location. These kits are $40 a piece, making this less than $250 for all 6 required by the bill. And this is 15% of what an AED machine costs. Local studies in California proves that this saves lives. With widespread availability of these tools and these techniques, more lives will be saved and result in less blood transfusion. I urge you to vote yes on AB 2260 for bleeding control kits to be made available where they are needed in the community to save lives and to stop the bleed.
Thank you very much. Go to the, see if there are any witnesses in opposition to the bill. Seeing none, we'll go to members of the audience who are in support or opposition. We'll just be asking for name, organization, and position if you have one on the bill. We have somebody moving towards the microphone.
Ryan Spencer, on behalf of the California Medical Association.
Thank you very much. Anyone else? Seeing no one, will go to the phone lines. Mr. Operator, please open the phone lines for anyone in opposition or support to the bill. Just their name, position, and organization, please.
Thank you, Mr. Chair. For comments in support or opposition, please press 1, then 0. Then command again 1, then 0. And we have no comments at this time.
Thank you very much. We'll bring it back to the committee for questions or comments from the committee. Seeing none, the bill does enjoy a due pass recommendation, Mr. Rodriguez. We don't have a quorum. Sound like saying that. Hoping we get a quorum, but we will at some point, so we can entertain a motion. Would you like to close?
Yes, I respectfully ask for my vote.
Thank you very much. Thank you to the witnesses. Mr. O'Donnell. Item number 15, AB 2034. Whenever you're ready, sir.
Thank you, Mr. Chair. Thank you, Mr. Chair and members. I'm pleased to present AB 2034.
Item number 18. I believe in search of a motion by Mr. Rodriguez, AB 2260. So motion by Mr. Santiago and a second by Dr. Arambula. I'm shell-shocked up here. Let's see. Madam Secretary, please, the motions do pass to judiciary. Please call the roll. Call the roll.
Wood?
Aye.
Wood, aye. Waldron? Waldron, aye. Aguirre Curry? Aguirre Curry, aye. Arambula? Arambula, aye. Bigelow? Carrillo? Carrillo, aye. Flora? Flora, aye. Mainshine? Mainshine, aye. Mays?
2260 by Mr. Rodriguez. Item number 18.
Mays, aye. McCarty? Nazarian? Nazarian, aye. Rivas? Rivas, aye. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Calra? Calra, aye. 13-0.
13-0. Thank you. Item number 19, AB 2666 by Mr. Salas, please.